To talk about prevention and treatments of bone and joint conditions. Dr. Alex Gachman, an orthopedic surgeon with Baptist Health. You've been here before. Thank you for coming back.
Thanks for having me. It's always a pleasure to talk to your audience about something that's so near and dear to my heart.
So talk about the most common bone and joint conditions.
Well, common bone and joint condition, it's a very prevalent problem. It plagues many Americans in the United States. For the majority of patients that I see in my office over the age of 40 are typically suffering from degenerative processes of their joints, typically osteoarthritis, which is when cartilage at the end of long bones starts to wear out and patients start getting joint pain, discomfort. In terms of bone diseases, it's typically osteoporosis is a common problem, especially in our aging population where the mineral density of bone decreases and increases your risk of having a fracture.
Okay, and so what are some of the symptoms you should look out for? Is it the minor aches or burning? You know, if we're doing things in our daily life, what should we look out for?
Yeah, that's a great question. Patients typically present with joint pain. They can have a myriad of symptoms and problems that they present with, but it's typically joint pain, discomfort. Most patients will have it after an acute onset, maybe a sporting injury or a twist or a fall. Some may have more of an insidious onset where they have pain that just kind of doesn't go away. Other symptoms can be swelling of that joint, could be a clicking, can even be a locking sensation. So the majority of people, especially myself, we have bone aches and pains, you know, maybe a weekly or monthly basis, but it should go away. If pain doesn't go away after a significant time period, after some oral anti-inflammatories or some rest and activity, that's when it's really time to get an evaluation from an expert in musculoskeletal disease.
If it sticks around for maybe you're working out or something like that, and it's longer than your regular recovery period, maybe.
Right, if it lingers.
Yeah. Okay. Are there any new treatments out there that you're working on right now to treat certain conditions?
So at Baptist Health, our orthopedic program has the ability to care for essentially all musculoskeletal diseases. We have specialists who are trained and experienced and can provide the most up-to-date standard of care. My personal practice is made solely up of hip and knee replacements, that allows me to hone and really tailor my skills and my clinical and surgical skills to create a treatment plan for the patients.
Yeah.
Most of our hip and knee replacements are now done on a same-day basis. They're done with some sort of computer robotic assistance.
Yeah.
And so what that means is you have your hip or knee replacement done and you're eating dinner at home with your family that very same day, which is quite nice, and we feel that's a better way to do these surgeries in a safer manner and decrease the risk of having a complication. Yeah,
we know technology is always advancing out there. We got to keep up with it. And then lastly, you know, if somebody is watching right now and look, I'm in my 30s, I want to make sure my bones, my health, my joints stay healthy. What should I be doing right now to prevent it? Or even people older than that watching.
Right, so some of the recommendations for healthy bone and joints are kind of the same ones that are for your general health. You want to eliminate the bad, the smoking, excess alcohol, the sedentary lifestyle, and you want to incorporate good habits as healthy eating and sleep and exercise habits. I think exercise is of utmost importance, and finding something that you really like to do will really ensure you're going to stick with it and you're going to do it, and just try to make that a priority. Do it at the beginning of your day if you can. It's usually when energy levels are the highest, and that'll really ensure your success and improve your quality of life.
Yeah, exercise is so important. I'm learning that the older I get. So thank you for dropping by and giving us all of these tips. And if you at home want to learn more about Baptist Health, or again, anything we just discussed, make sure you go to our website. Just search Bone Health. Sandra?
All righty, well, let's take